Hi, I'm Charlene Wong, the Executive Director of the North Carolina Integrated Care for Kids, or NC Inc. model, and a pediatrician at Duke University. We're excited to introduce you to NC Inc. and how we're working to improve the health and well-being of children and families in North Carolina. NC Inc. is partnering with communities in Central North Carolina to support and bridge services where children live, learn, and play. We work with families who have children insured by Medicaid or NC Health Choice from birth up to age 20 and who live in one of 5 NC Inc. model counties: Alamance, Orange, Durham, Granville, or Vance County. Our goal is to help children thrive, and we know that their ability to reach their full potential is influenced by a lot of different people, factors, and services. For example, imagine Jonathan, a 12-year-old about to go in for his well child check. He may be having trouble at school because he doesn't have enough food at home to eat, or perhaps he has depression that hasn't yet been detected or isn't being treated. Or Lucia, a 5-year-old who appears healthy at her kindergarten checkup, but her doctor doesn't realize that her mother is struggling with her own mental health issues and is having trouble paying for rent and Lucia's daycare. Right now, it's too easy for these issues to go unnoticed or unaddressed, but we're hoping to change that.
Hi, my name is Jamila Freeman, and I am a wife, mother of 3 boys, and a licensed clinical mental health counselor. My middle son, Jackson, was born blind and hearing impaired and later diagnosed with autism. When Jackson first began to display atypical behaviors that we could not explain, we were told there would be a month-long wait to see a specialist. And during that time, things began to decline. But thankfully, a personal connection at UNC led us to Dr. Steiner. For me, Inc. is not only an opportunity to talk about what's working, but it also gives us an opportunity to shine a light on gaps that are currently happening in the system. If we do not know who to refer a child and family to, or we do not triage the situation appropriately, that could lead to more difficulty for the child and family.
As a pediatrician, I know that resources often are available to help support children and families in addressing challenges like those Jamila just described. Sometimes those are available in physician offices, but often those resources are available in local communities. Despite knowing that resources might be available, it's often hard to connect families to those resources. And when families are getting support from teachers in schools or community agencies or therapists, it's often very difficult for these different supports in different locations to work together in an integrated team to support the needs of children.
In addition to building these new bridges between healthcare and social support services that children need, NC Inc. is developing new ways of paying for care called alternative payment models. Our goal for the payment models is to support coordinating care for children beyond traditional healthcare, improving their health and well-being, and reducing the cost of their care.
One of the things we are most excited about in this project is the coalition of families, youth, and service providers who are leading this model together. Our NC Inc. Partnership Council is made up of representatives from families, teens, young adults, and all of our core child service areas. It is important to me that we always guide our decisions with the needs of the children and families in mind. We are doing it for them, and we will think of them at every step.
There is a large coalition of organizations working together to create the work of NC Inc. The lead organizations are Duke University and the University of North Carolina, but we're working in partnership with the North Carolina Department of Health and Human Services. Although Duke and UNC are involved and leading the work, all children in the 5-county area included in this program who are insured by Medicaid and CHIP will be included whether or not they receive their health care at Duke or UNC.
All of our coalition partners will be involved in finding the best way to reach children across our communities. We're taking our time to make sure we engage the right voices and creating a model that works well for children across our service area. We started NC Inc. in January 2020 with the beginning of a 2-year planning period, a time to reach out to families and community partners and make sure we're building a model together. After our 2-year planning period, NC Inc. will launch its new model of care coordination for children in 2022. We are excited about the work of the NC Inc. model. Hope you are too. If you'd like to get more involved with our efforts, go to our website and sign up for our newsletter, or reach out to us about ways integrated care for kids can be improved in your community.